Okay, so back to talking about CI. Sorry about that interruption. So, when we're talking about CI, we're talking about cognitively impaired. We're talking about an individual who has earned an IQ score below like 71 and further. So, this is not if an individual has performed on a IQ test and they have some strengths and weaknesses. We understand about relative strengths, meaning that the individual may have a 80 or 85 on, say for instance, their nonverbal skills. We're talking about an individual with across the board have low scores. And sometimes it's really good practice if you can go back and tap into it again to make sure that their testing ability was exactly what you believe it was the first time, meaning the scores on the next instrument was equally as low. And so when checking the validity of these testing scores and whatever instrument you want to use, you can test again and the score should actually commensurate, meaning that they should be equal. Because if an individual is CI, meaning also their adaptive skills, not just in the school setting, their adaptive skills in the school setting, at home, and in the community is low, then they may meet the classification for the CI. Okay. The next area is deaf and blindness. So you have to make sure that you use the instruments for both and have a individual who is certified in that area to actually be the one to determine that, as well as visual impairment, deaf or hearing, deaf or hard of hearing. Okay, those are separate, and you have to have an individual who is actually certified to be able to make that difference. Okay. The next one is the early childhood developmental delay. It is also one that we need individuals to score lower than their chronological age on the test that was administered. And so sometimes it's really hard for this one, right? It's really hard for a little one to meet the basal, meaning for them to be able to take standardized tests and to achieve you moving forward. So you need the whole team to come together and look at the data and then determine. And there are instruments that can actually do the measurements. You can do the cars, you can do the Patel, you can do quite a bit of other instruments. You could do the WISPy. I mean, to determine the IQ of a little one at such an early stage is really not significant. What you're trying to do is obtain their strengths and weaknesses so you'll be able to know how can you create more goals for them so that they can successfully be involved in the general education curriculum, or if they're homeschooled, how can they be able to obtain information. Okay. The next area is emotional impairment. Now, this is one that is very tricky, and we should use this one with caution, right? We do not want this one to be the one that beelines us from here to juvenile detention center, from juvenile detention center to jail, right? So, and emotional impairment is a very heavy diagnosis. We need to make sure that this individual is not just responding to trauma, not just responding to acting out. We really need to do our due diligence in regards to this diagnosis and be safe with it. Okay. Another one is physical impairment. And so, of course, for these, as you see, there are so many. It's very important that you have a team, a full gamut team who is able to certify an individual in this area. So, in saying that, we definitely need our PT involved, right? Physical therapy is important. They went to school, they work so hard. They're able to determine and do different tests and assessments to see if, in fact, the individual has the physical impairment. The other health impairment is one that sometimes get linked in with another classification because we may see this with an individual who has ADHD or something else, and we may link that as a primary and a secondary diagnosis. This is just depending on how acute their problems are in terms of how are they negatively impacting their performance, their daily performance within the school setting. Okay. The next one is severe multiple impairments. So again, if there are more than two and we want to link that up, or we just want to go with a severe instead of clicking all of them, we can definitely be very detailed within our report to identify these strengths and weaknesses. Specific learning disability often is used for like reading, writing, math, um, verbal, written, oral comprehension, and expression. So those will be very specific to what the TC, the teacher consultant, and definitely getting some of that great information from the general education teacher who can provide what kind of help will they need. And although Michigan is not a state that does look at the difference on the strengths and weaknesses in terms of which scores were completely high versus the scores that is low, we look at comprehensive work. We also look at attendance. We also look at the state's scores, right? Standardized scores like the NWEA or MAP or other scores. We want to collect all of that good data and make sure that we determine with that. The next one we have is the speech and language impairment. And so once again, our great speech and language pathologists who are very definitely overworked, right? And they have tons of loads, but you need them on that to be able to tell you if in fact we're going with the speech and language impairment classification. Okay. Traumatic brain injury. So, an individual can suffer from a TBI and it can definitely negatively impact their daily performance as well as their school daily performance, right? So, we want to be aware of that and allow them an IEP that we can help them gain their strengths and weaknesses and create some wonderful goals. And then, as already mentioned, the visual impairment. So, those are our 13 categories. Again, 1, ASD, cognitive impairment, is 2, 3, deaf and blindness, 4, deaf or hard of hearing, 5, early childhood developmental delay, 6, emotional impairment, 7, physical impairment, 8, the other health impairment, 9, severe multiple impairments, 10, specific learning disability, 11, speech and language impairment, 12, traumatic brain injury, and 13, which is visual impairment. I hope that was helpful.